My name is Hemant Murthy. I'm an associate professor of medicine at Mayo Clinic in Jacksonville, Florida. On behalf of my colleagues, I'm privileged to present a U.S. multi-center collaborative study on outcomes of hematopoietic cell transplantation in hepatosplenic T-cell lymphoma. Hepatosplenic T-cell lymphoma is a rare and aggressive peripheral T-cell lymphoma with an aggressive clinical course, typically presenting with hepatosplenomegaly, fevers, night sweats, and associated with dismal outcomes, or reported 5-year overall survival less than 10%. Case reports and small case series previously demonstrated hematopoietic cell transplantation can be a benefit in this disease. However, given the rarity of this disease, more info is really needed to help guide clinicians about the utilization and efficacy of stem cell transplant, which prompted this subsequent work. This was a collaborative effort with 12 centers in which we looked at outcomes of both autologous and allogeneic hematopoietic cell transplant in hepatosplenic T-cell lymphoma. We identified a total of 53 patients, of which 36 of these received an allo transplant and 17 received an auto transplant. The median age was 39 for allo transplant and 38 for auto transplant, with 4 patients included who were age 16 or younger. Nearly 90% had gamma delta phenotype, 90% had splenomegaly at diagnosis, and 41% with hepatomegaly. Nearly half the patients received a splenectomy prior to transplant. Most received a myriad of therapies prior to transplant, including CHOP, hyper-CVAD, ICE, and other therapies. 61% of these patients received a transplant in CR, with the remaining patients receiving transplant in PR, with 1 patient receiving a transplant with stable disease. When we analyzed the data, we found that overall survival for the entire cohort was 78.5 months and the progression-free survival of 54 months. In the allo transplant, relapse at 1 and 3 years was 13 and 35% respectively, with non-relapse mortality of 1 at 1 year and 3 year of 11% and 16% respectively. When we looked at the auto transplant group, we saw that 1 year and 3 year relapse incidence was 28 and 43%, and non-relapse mortality of 1 year and 3 year of 7 and 14%. We did not find any statistical significance in overall survival, non-relapse mortality, and relapse between the auto and allo transplant groups. However, another important finding was the association of complete remission with transplant outcomes. We were not able to find a statistically significant difference in patients receiving allo transplant in CR versus transplant not in CR. However, in the auto transplant group, those who received a transplant in CR had a median overall survival of 65 months compared to 7 months in those who received an auto in less than CR. The key takeaways that we took from this effort are the following. 1, stem cell transplant is an effective treatment that can prolong survival in patients with hepatosplenic T-cell lymphoma, and these patients should be referred as early as possible to transplant centers for evaluation. 2, there may be a role for auto transplant in hepatosplenic T-cell lymphoma. This can certainly be a consideration for older patients, though I still would recommend reserving this for those patients who maybe cannot receive an allo transplant, but ensuring that these patients are ideally in CR before taking them to an auto transplant. And third, more data really is needed to further validate these findings, but this work is important and really raises the importance of these type of studies, either through collaborative efforts or large registry studies, which are crucial to help clinicians with management and transplant outcomes of rare diseases such as hepatosplenic T-cell lymphoma.